All right, so we're going to be talking about window entrapment trauma in cats, and you want to get into this on like a doctor level.
Yeah.
So let's do it. We're looking at a 2024 study from the Journal of Feline Medicine and Surgery. And they looked at 70 cases
Okay.
from both referral and first opinion clinics.
Yeah, so this is really getting into some of the nitty-gritty details of what we call Kipfenster syndrome.
Oh, wow. Interesting name. I'm assuming that's what it's called.
Yeah, it's a German term for bottom-hung windows.
Gotcha.
Wow.
Which is very common in Germany.
Yeah, they are.
And it's the kind that tilts in from the bottom.
Yes.
And so cats, being the curious creatures that they are, like to explore, and they see a gap and they think, oh, that looks fun.
Exactly. It's like a little kitty cat trap.
Yeah.
And they get stuck in there. And the biggest problem with getting stuck is they typically get stuck around their thoracolumbar area.
So like their mid-back.
Yeah, their mid-back.
And then they can't get out.
And what happens is you get ischemia to the spinal cord muscles, nerves, kidneys.
So what exactly is going on there? You said ischemia.
Ischemia.
What's happening?
It's essentially reduced blood supply to the area.
So it's like cutting off circulation.
Exactly. And so when you cut off circulation, you cut off oxygen, nutrients, and all the things those tissues need to survive.
Got it. So the longer they're trapped,
The worse it gets.
the worse the damage is.
Absolutely.
So let's talk about neurological impacts.
Okay.
The study mentions a whole range of problems from like weakness to paralysis.
Right. And those are all due to the ischemia. And those neurological signs are a direct result of that.
Okay.
You know, the spinal cord is such a delicate structure.
Right.
And when it doesn't get the blood supply it needs, it can lead to nerve damage dysfunction.
Yeah.
And then the most common thing we see clinically is what we call paraparesis.
Paraparesis.
Which is weakness or paralysis of the hind limbs.
Okay.
So they can't use their back legs.
Gotcha.
And then often that comes with problems with bladder control.
So they can't pee.
They can't pee.
Yeah.
So the study found that a lot of cats presented with urinary retention, which is the inability to pee.
Right. And again, that's all stemming from that spinal cord injury.
Spinal cord injury, yeah.
It's fascinating how the study compares this condition to like feline aortic thromboembolism and traumatic ischemic myelopathy.
Yeah, it's really interesting. The comparison is apt because you're essentially getting ischemia in all of those conditions.
Yeah.
Whether it's caused by a blood clot or physical trauma to the spinal cord.
Right.
This is just another way of getting spinal cord ischemia.
Okay. And then on top of the initial injury, you have like the added complication of reperfusion injury.
Right. That's a really important concept to understand.
What exactly is going on with that?
So reperfusion injury is basically the damage that occurs when you restore blood flow after a period of ischemia.
So it's not just the lack of blood flow, but then when the blood flow is restored?
Exactly.
Oh.
Like this double whammy.
Oh, wow. That's wild.
It is. It's kind of a paradoxical phenomenon where the return of oxygenated blood, which is normally a good thing, actually triggers these inflammatory processes.
So it causes even more damage.
More damage, yeah. And that can lead to things like respiratory distress and multiple organ dysfunction.
And that's similar to what we see in humans with crush injuries.
Exactly. They draw that parallel to crush injury syndrome, which you see in like earthquake victims and things like that.
Right.
Where they've been trapped for a long period of time. And then when you release that pressure, all of a sudden you get this influx of inflammatory mediators and things that can cause damage.
Okay, so let's dig into how the study was actually done. They had 70 cats.
70 cats.
How did they choose these cases?
So they specifically chose cats that had a confirmed diagnosis of window entrapment trauma.
Right.
And for each cat, they really meticulously documented the clinical signs that they saw, the neurological findings on exam, and what we call clinicopathological data, which is basically blood work.
Let's talk about each of those a little bit more. What kind of clinical signs were they looking for?
So for clinical signs, they were looking at things like body temperature, specifically if the cat was hypothermic, which is low body temperature, which is very common in these cases.
Oh, okay.
They were also looking at femoral pulses.
Femoral pulses, which is basically
the hind legs, right?
in the hind legs.
Yeah.
So that's how we assess blood flow to the hind limbs.
Gotcha.
And in severe cases, the femoral pulses might be weak or absent.
Okay. And then they also looked at the neuro exam, right?
Yes. So they did a very thorough neurological exam on each cat, focusing on things like gait, which is basically how the cat walks.
Right.
They also looked at urinary bladder function. And a really interesting thing is they looked at tail function.
Tail function.
Because it turns out tail function is actually a really strong predictor of outcome in these cases.
Okay, so tell me more about these neurological categories. How do they evaluate each one?
So they use this standardized system to grade the severity of the neurological deficits.
So for example, with gait, they would assess the cat based on, can they walk normally? Are they a little bit wobbly? Are they completely paralyzed? So they had like a scale that they would use.
A grading scale.
A grading scale, exactly.
Okay.
And then with the bladder function, they looked at, can the cat pee on its own? Or does it need help peeing?
Does it need to be expressed?
Does it need to be expressed?
Exactly.
And then tail function. What were they looking for there?
So with tail function, they looked at both sensation and motor.
Oh.
So could the cat feel if you touched its tail? Could it move its tail on its own? And what was the tone of the muscles in the tail?
Interesting. Okay. So they did all those neuroassessments, and then they did the blood work. You mentioned that.
Yeah.
What specific tests were they running?
So they ran like a standard panel of blood tests,
Okay.
including a CBC, which is a complete blood count, and serum biochemistry, and a urinalysis.
And within that serum biochemistry, they were looking at markers of muscle and kidney function.
Yes.
Like what? So for muscle damage, they were looking at things like creatine kinase, which is often abbreviated, CK aspartate aminotransferase, which is AST, and alanine aminotransferase, which is ALT.
Gotcha.
And those are all enzymes that are released from muscle cells when they're injured.
So if there's muscle damage, you would expect those to be elevated.
Exactly.
Okay. And what about the kidneys?
So for kidney function, they were looking at creatinine and urea.
Okay.
And those are waste products that are normally filtered out of the blood by the kidneys.
Okay.
So if the kidneys aren't functioning properly, those levels will be elevated in the blood.
Got it. So they were essentially looking at how high these values were compared to like the normal range
That's right.
to see how much damage there was.
Exactly. So they would categorize the blood test results based on, was it within the normal range? Was it mildly elevated, moderately elevated, or severely elevated?
So they were really trying to paint a comprehensive picture of each cat's overall condition.
They wanted to know not only the immediate effects of the injury, but also like what is the potential for long-term problems.
So we've talked about how they gathered all this data.
Yes.
What did they find? What were some of the key takeaways?
So one of the really interesting things is that the overall survival rate was really high. 90% of the cats in the study survived.
And 90%.
Wow. That's a lot higher than I would have thought.
It is. It is.
Yeah.
And they think that this higher survival rate compared to previous studies might be because they included both referral and first opinion clinics.
So a broader range of cases.
Broader range, exactly.
Interesting. So what other insights did they get from the data? Like what factors were associated with better outcomes or worse outcomes?
Well, the tail function thing that I mentioned earlier, that was huge.
Okay.
So cats that had absent tail sensation, motor function, and or tone.
So basically they couldn't feel or move their tails.
Exactly.
Yeah.
They were 24 times more likely to die.
Oh, wow. That's really significant.
It is. Why do you think tail function is such a critical indicator in these cases?
That's a good question. And the study doesn't give us a definitive answer, but they think it probably has something to do with the severity of the spinal cord injury.
Okay.
So the cats with the really bad tail dysfunction probably have more extensive damage to their spinal cord,
Okay.
and that could explain why they're more likely to die.
So that's something that vets should really pay attention to.
Absolutely.
If they see a cat that has no tail function, that's a sign that things might not be going so well.
Yeah, it's a red flag for sure.
Okay. So bad tail function is a bad sign? What other things were associated with a worse outcome?
So severe hypothermia, meaning a very, very low body temperature, was also a bad sign.
Okay.
And an absent femoral pulse, again suggesting that there's not enough blood flow getting to the hind limbs.
And if they have both of those things,
Then that's a really bad sign.
really bad sign.
Okay.
And it highlights the importance of getting these cats to the vet quickly.
Yeah, time is of the essence. It is. The sooner they get treatment, the better their chances of a good outcome.
So we've covered a lot of ground in this first part of our deep dive. We've talked about the mechanism of the injury, the neurological impacts, the significance of reperfusion injury,
Mm-hmm.
and we've started to delve into some of the findings of the study.
Yes.
But let's take a break here and come back for part 2, where we can unpack those blood test results a little bit more.
Sounds good. From Vet Neurojar, keep those minds-inspired hearts light and tails wagging.
Welcome back. We're in the middle of this deep dive into window entrapment trauma in cats.
Yeah, we're really getting into the thick of it now. Looking at this 2024 study, all those details.
Yeah, it's fascinating stuff. So last time we were talking about how the study looked at clinical signs, neurological assessments, and blood work. And we're just starting to get into those blood test results. You mentioned they were interested in markers of muscle and kidney function. So what did they find there?
Yeah, so when it comes to the muscle enzymes like the CK, the AST, and ALT, the results were a little bit less clear-cut than you might expect.
Really? How so?
Well, remember, these are enzymes that are released into the bloodstream when muscle cells get damaged.
Right. Right.
So you would think that they would be like sky high in these cats.
Yeah, considering the muscle injury from being trapped.
Exactly. But it turns out that the timing of the blood draw, like when they actually took the blood sample, made a big difference in the results.
Oh, really?
Yeah, so these enzymes, they peak at different times after the injury. So depending on when they took the blood, the results might not actually reflect how much muscle damage there really was.
Oh, so like a cat could have a lot of muscle damage, but if they took the blood too early or too late, it might not show up on the tests.
Exactly, exactly. And that's one of the limitations of doing a study like this, where you're looking back at data that was already collected. You don't always know exactly when those blood samples were taken.
Right. That makes sense.
Oh.
So what about the kidney function markers? You mentioned creatinine and urea.
Yeah, so this is where things get really interesting. The study found that severe increases in creatinine and urea, although it wasn't super common, but when it did happen, it was strongly associated with death.
Oh, wow. So that means those cats had a lot of kidney damage.
Exactly. It seems like in some cases, that decreased blood flow during the entrapment. It wasn't just affecting the muscles in the spinal cord, it was also affecting the kidneys.
And that's obviously a very serious complication.
Oh, absolutely. The kidneys are vital organs. They filter waste products from the blood, they regulate electrolytes, all kinds of important stuff. If they're badly damaged, it can be life-threatening.
So even though most of the cats in this study survived, the ones with those really high creatinine and urea levels, they were much more likely to die from their injuries.
That's right. It really highlights how important it is to monitor kidney function in these cases, even if the cat seems like they're doing okay otherwise.
So we've got the clinical findings, the neurological assessments, the blood work. It's like putting together a puzzle.
Yeah. It is. Each piece gives you more information and helps you understand the whole picture.
And it underscores how important it is to do a thorough workup on any cat that you suspect might have been trapped in a window.
Absolutely. You got to look at everything.
Okay, so we've talked about the study itself, but let's shift gears a little bit and talk about what this all means for cat owners. What are the practical takeaways from this research?
Well, the biggest takeaway is that this is a preventable injury.
Okay, good. We can do something about it.
We can. By understanding the risks and taking some pretty simple precautions, we can protect our cats from this.
So let's talk prevention. What can cat owners do to make their homes safer?
The most effective thing is to install window guards on all bottom-hung windows.
Window guards. Okay, tell me more about those. What are they and how do they work?
They're basically barriers that prevent the cat from getting into that gap in the window. The most common type is like a mesh screen that attaches to the window frame.
So you can still open the window, but the cat can't get through.
Exactly. It's like a little safety net for your cat.
And you can get these at pet stores or online.
Oh, yeah. They're pretty easy to find. Just make sure you get ones that are specifically designed for cats.
Why is that? Wouldn't any window guard do?
You'd think so. But cats are really good at squeezing through small spaces. They're like little Houdinis. So you need a guard that's sturdy enough to withstand their antics, and one that has a mesh size that's too small for them to get through.
So it's not just about keeping kids from falling out.
No, this is specifically for cats. They're little escape artists.
Okay, so window guards are a must. Anything else cat owners should be doing?
Well, even with window guards, it's important to be mindful of open windows, especially those bottom-hung ones. It's just about creating a culture of safety in your home. You can never be too careful when it comes to your cat's well-being.
I like that. A culture of safety. So even with the guards, we still need to be vigilant.
Yeah, think about it. Cats are curious creatures. They're attracted to movement. Anything new or different in their environment. An open window, even with a guard, it might still pique their interest, you know?
So we need to supervise them. Make sure they're not getting into trouble.
Exactly. And it also helps to know your cat's personality. Some cats are more curious and adventurous than others. They might be more likely to explore those open windows.
Right, so we need to tailor our precautions to our individual cat.
Precisely. If you've got a cat that's a known window explorer, you might need to take extra precautions.
Okay, that makes a lot of sense. So we've talked about prevention. What about if a cat does get trapped?
Yeah.
What should owners be looking for?
Well, the signs can be subtle at first, so it's important to really pay attention. If you see any sudden changes in behavior, like if they're suddenly lethargic or reluctant to move, or if they seem painful, that should be a red flag.
And if you see any of those signs,
Get them to the vet right away. The sooner they get treatment, the better their chances of a full recovery.
so time is of the essence.
Absolutely. Every minute counts.
So prevention, knowing what to look for,
Mhm.
and getting them to the vet quickly, that's the key.
That's the crux of it. Yeah.
Okay, this has been really informative. Before we wrap up, let's just recap those main points about the blood test findings.
Sure. So we talked about how the muscle enzyme levels, the CK, AST, and ALT, they weren't always reliable indicators of muscle damage because of the timing of the blood draw.
Right. And we talked about how those really high creatinine and urea levels, that was a bad sign, indicating kidney damage and a higher risk of death.
Exactly. Those are the two big things to remember.
All right, so we've covered a lot of ground. In the next part of our deep dive, let's talk about the study's limitations and what they mean for future research.
Sounds good.
And we're back. Still talking about window entrapment in cats and all the insights from this 2024 study.
Yeah, it's been a really in-depth look, hasn't it? We've gone through a lot of information.
We have. I mean, it's made me realize just how serious this condition can be. But like you always say, no study is perfect.
Right, exactly. And this study being retrospective, it relies on data that was already collected. So there are definitely limitations to keep in mind.
Like what? What kind of limitations are we talking about?
Well, for one thing, there's inherent variability in how those assessments were done, at different clinics. They might have had slightly different ways of evaluating the cats.
Oh, that's true. Plus, it was a multicentric study.
Right.
So you've got different vets involved.
Exactly. Each vet with their own approach and their own level of experience. So that definitely adds another layer of complexity.
So we're dealing with some inconsistencies in the data.
It's something to consider.
Yeah. And then we also have to think about the influence of euthanasia decisions.
Oh, right. Because if a cat was really badly injured, the owners might have opted for euthanasia, even if the cat could have potentially survived with a lot of treatment.
Exactly. And that obviously affects the outcome data because those cats are counted as non-survivors, even though they might have pulled through if they had gotten all the interventions.
It's a tough decision for any owner to make.
It is. It is.
Yeah.
And it's something that we have to acknowledge when we're interpreting these results.
So that's something to consider.
Yeah.
Anything else? Well, another limitation is that this study only looked at short-term outcomes, specifically survival to discharge.
So they don't know what happened to the cats after they went home.
Right. We don't know if they fully recovered, if they had any lasting complications. Those are all questions for future research.
It always seems like there are more questions.
Right. Always. That's how science works. One study leads to another.
But even with those limitations, this study still gives us some really valuable insights.
Oh, absolutely. It really highlights the dangers of window entrapment, the importance of prevention, and it helps us understand how to best care for these cats if they do get injured.
And it's amazing how much we've learned from just 70 cases.
It is. But that speaks to the power of good research design and careful data analysis.
Oh, I feel like I've learned so much from this deep dive. I definitely have a renewed sense of urgency about cat safety, and I hope our listeners do too.
I hope so too, because these are preventable injuries, and we can all do our part to protect our feline friends.
Well, thank you so much for sharing your expertise with us today. This has been an incredibly informative conversation.
My pleasure. And remember, from Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.